We're back again with Janelle Gibson. She's a pelvic floor physical therapist at the University of Utah Orthopedic Center, and she has previously helped us to understand what the pelvic floor is, where it sits in the skeleton, and what organs are within it. Janelle, after a woman has a baby, what changes might she experience in her pelvic floor? And can you tell us about the symptoms?
Yes, absolutely. So, in short, it really depends on the woman. We know that during the second stage of labor, the pelvic floor muscles and ligaments undergo quite a bit of stretching, and that can result in some changes or dysfunction in the pelvic floor. In the clinic, women describe a variety of different symptoms that would kind of make us think there might be something going on with the pelvic floor. A lot of women will describe looseness, heaviness feelings in that region. Some women just have a hard time articulating, but it feels just different is what they'll describe. Symptoms of pelvic floor dysfunction specifically include urinary incontinence, so leakage of urine, bowel incontinence, so leakage of stool, as well as constipation, so that can also be a sign of pelvic floor dysfunction. Urinary urgency or frequency, so going way more often than you feel like you may have previously gone to the restroom, difficulty urinating, pain with intercourse, and then changes to the feeling of how deep the vaginal canal is. So some women will describe that intercourse seems more painful now because there seems like there's something blocking the region, or there's something getting in the way.
Is there anything that can increase a woman's risk for muscle injury?
Yes, so during vaginal delivery, there are a few different things that can increase risk for muscle injury. First and foremost is use of instruments or tools during delivery. Sometimes during delivery, doctors or midwives have to use forceps or vacuum assisted to allow delivery to progress. And so those two things can increase risk for injuring the pelvic floor muscles. Second is tearing that can occur during delivery between the vaginal and anal openings. So if we look at the pelvic model again, I'm going to show you where tearing typically occurs during delivery. So again, if we look here, we've got clitoris, urethra, vaginal opening, and anus. This piece of tissue here between the vaginal opening and the anus is called the perineal body, and that's typically where tearing occurs during delivery. If a woman undergoes an episiotomy for any variety of reasons, this is also where the episiotomy is going to occur. So if you do sustain a tear during delivery, it's really important that you follow up with your physician afterward to make sure everything's healing properly.
And can you tell us what is the normal recovery time?
Yeah, absolutely. So after vaginal delivery, as we know, the muscles and nerves get a little bit stretched during delivery. Muscles and nerves heal at different rates, but typically anywhere around from 6 to 8 weeks is enough time for a muscle injury to heal anywhere in the body. And so that includes the pelvic floor.
When should a new mother go to a pelvic floor physical therapist?
So the muscles and nerves need time to heal first. And so first and foremost, a woman needs to discuss any concerns about her pelvic floor with her physician first. We typically will see referrals from OB gynecologists or midwives about 6 weeks after a woman has delivered, after her 6-week checkup. During that 6-week checkup visit with the doctor or the midwife, they're going to be checking for a variety of different things, checking to see if you've healed, especially if there was tearing or any stitching, making sure there's no wound problems there. And then that's usually when you're going to get clearance to return to exercise or return to sexual activities. This is the best time for a woman to voice concerns that she might be experiencing of those symptoms we talked about earlier within the pelvic floor. A lot of times it gets missed. The visits are really fast, but a woman shouldn't really hesitate at all to bring those things up to her doctor because they're really important.
And can you remind us what those symptoms include?
Yeah, absolutely. So symptoms of pelvic floor problems after delivery would be urinary incontinence, stool incontinence, issues with heaviness or any signs that there may be prolapse, looseness, difficulty with intercourse, and any pain in the entire pelvic region in general.
Can you tell us what happens to a woman's pelvic floor as she grows older or has more children?
Yes. So as we age as women, we experience a few different things. We have hormonal changes that occur, our bone density changes, and then our muscles also change. So as we age, our pelvic floor muscles do get a little bit weaker. There's been some research to show that. In addition to that, as we have more children, we are more at risk for developing pelvic floor disorders, specifically with more vaginal deliveries. So one particular disorder that is known to increase with both age and or more vaginal deliveries is pelvic organ prolapse. So I'm going to go ahead and show you on the model what pelvic organ prolapse is. It's essentially loss of support from the pelvic floor and the pelvic ligaments within the pelvis. So again, if we go back to our pelvic model here and we're looking inside of the pelvis of the different organs, we have the bladder, the uterus, and the rectum. And all of those muscles are supported by the pelvic floor and the ligament. So as we age or as we have more vaginal delivery, those muscles and ligaments do have a tendency to stretch and weaken, and that's going to increase somebody's risk for developing pelvic organ prolapse. There's more detail, including videos discussing the different conditions of pelvic floor dysfunction at voicesforpfd.org.